hello to everybody. We are the ESH Congress in Gdansk, and we are supposed with Stefano to summarize day 4 sessions, the morning sessions only, as it's 11 o'clock now. So I will first start and ask Stefano, how did you like today's sessions? What was the highlight that you saw today?
Well, I think one of the most important topic that we saw this morning, that is probably one of the most important topic also of the World Congress, is the importance of correct risk stratification in women. We increasingly understand that there might be some differences in the cardiovascular risk of women compared to men, but this is still not quite appreciated in the guidelines. And the 2 sessions that I attended this morning actually were quite important from that perspectives. They highlighted the importance of considering, for example, disease during the pregnancies in order to better refine cardiovascular risk in women, even in the long term after pregnancies, providing very important information also about the pathophysiological pathways that could account for that, and was very fascinating actually, because some of these pathways are just being discovered. And there is still quite a lot that we don't know about these pathways that at the same time influence our, in some way, limited capacity to understand how we can treat these kind of diseases and how we can optimize the future cardiovascular prevention in these women actually. So I think it was a very important joint session between the European Society of Cardiology and the European Society of Hypertension that nicely close up this very nice congress.
Okay, and the other session?
Well, the other session, it was an abstract session, and it was, again, very interesting because there was a presentation about several abstracts for very young people, which I think is nice because this year, this Congress, we saw new generation of hypertensive specialists that, again, try to understand a little bit more about what is happening during pregnancy, what is causing cardiovascular risk in pregnancies, and how can we in some way improve our understanding of the disease during pregnancy. So for example, there was a very nice presentation about when should we do an ABPM in pregnancy in order to understand what is the risk for the women that will develop elevated blood pressure later on. What is the critical period, in other words, that we have to target with this kind of examination. So I think a lot of discussion, a lot of very good presentations, even from very young people that will shape our future in the way we will manage hypertension. But what about you?
Okay, I was in 2 sessions. So the first session in the morning were clinical cases. So actually young doctors were presenting different patients. This was clinical pathological conference. The actual title was a bit wrong because the actual title could be like, how do we miss our diagnosis for years? So the young physicians really showed us really difficult cases. The first case was actually fibromuscular dysplasia with initial very unspecific symptoms, including hemorrhagic stroke, and obviously initial imaging tests didn't show fibromuscular dysplasia, only to reveal it after years and another complication occurring in the coronary vessels. And the other case was primary hyperaldo, which was masquerading by concomitant secondary hyperaldosteronism. So the patient had a long history of hypertension with hypokalemia, but also additional problems like additional renal arteries and untreated obstructive sleep apnea. And only after correcting obstructive sleep apnea, they were able to actually diagnose the primary hyperaldo. And the other session was actually complete opposite, because the first one was young doctors discussing difficult cases, and this was like young wine. So I thought my first session was like drinking Beaujolais, and the other section was actually Italian Barolo, because they were old, distinguished, renowned professors doing 2 very, very nice and very quite important debates. The first debate was actually, should we do cardiovascular risk prediction in all patients with hypertension? And obviously the answer is, if you go to a place like this or lecture like this, well, it's quite obvious. How can you be again, and how can you be against it? And Professor Masi did a splendid presentation at the age of 84. Showing us that actually, yes, obviously we have to look for cardiovascular risk, but the important point from his point of view was that actually looking at other cardiovascular markers does not really change the decision when we decide between various antihypertensive drug classes. That was actually amazing to see him. I remember when I started my career in hypertension like 30-something years ago, and then he was renowned professor and expert in many things in hypertension, cardiovascular disease, and now I'm nearly 60 and he's now 84 and still brilliant brain giving a full lecture. So it's wonderful for us also. And the other debate was also very interesting, and also a topic that came during this Congress very often, the primary hyperaldosteronism, the prevalence, how should we diagnose this? And first of all, the debate was, should we screen everybody? Yeah? So again, there was a very nice debate between Professor Bolatero and Professor Williams. The first one was had a pro stance, and she showed us lots of arguments that we actually should look for primary hyperaldosteronism in many patients. Maybe not necessarily all, but basically in many patients with hypertension. Yeah? So he concluded saying that now we don't have to think who should be screened, but we should actually think who does not need to be screened. Yes, and obviously Professor Williams, which is very renowned in debates, did a stance contra, and he actually said, yes, it's complicated, so maybe we shouldn't bother our primary care physicians because it will be quite complicated in many aspects. But he also said something that's very interesting, that the solution is also contra, because we could try drugs that deal with primary hyperaldo in everybody and to see the blood pressure response. So one of his main answers was, we have better marker, we have blood pressure response to an aldosterone antagonist. That reminds me of Professor Funder paper many years ago. He was also asked, should we look for primary hyperaldos? He said, no, just give them spironolactone and see what the blood pressure response is. And now today's Professor Williams' conclusion was that we will soon be able to give new anti-aldo synthase drugs and to see blood pressure response. So it was really nice thing to show, to see the first debate with young doctors, young wine, and then the old professors, the old wine, and both inspiring me to do different things. So it was very, very, very good experience with just 2 sessions.
So probably we could say that we finished a congress that was dedicated to very common disease, cardiometabolic disease, with a focus on new risk factors and the re-emergence of old pathways. As a summary of the session.
Yes, there was tremendous number of new avenues. Also, the things we didn't discuss today, for instance, new blood pressure measurement devices, cuffless, wearables, and so on. This was not in our sessions, but also very interesting. So really, I think the Congress is a place for young doctors to learn things, and also old doctors to contrast their experience and knowledge with what's going on in hypertension, really. And it's really ongoing and vivid area of medicine, really. I would ask Stefano, how did you like Gdańsk, Poland? Are you here for the first time?
It was the first time for me to be in Gdańsk, and I really enjoy it. You have a fantastic city. Everything was very well organized. I have to compliment Professor Narkiewicz for the great job he has done together with Professor Januszewicz to organize this Congress. And I think we really increased the bar toward really a Congress that is at the top level in terms of hypertension, in terms of people attending the Congress, in terms of information that you can get. And what was extremely nice, I have to say, is the friendship that emerged during the Congress. Very experienced people with very young people communicating each other, increasing their knowledge each other. That was an absolute pleasure to see the atmosphere that was created during these 4 days of Congress. What do you think?
Well, for us, it was, I think, the first ESH Congress in Poland. So we are always nervous. How do we look in other people's eyes? So people come from really different countries here, not only Europe. I saw lots of participants coming outside Europe. So it's really important. I think that all the team and everybody did a great job, and everybody will have only good impressions from their visit in Gdansk here today.
Thank you very much. It was a great pleasure to be here, and it was a great pleasure to have the opportunity to visit your city and to see such a beautiful country.
Thank you very much also.